Insulin Therapy Clinical Essentials. Welcome to the 5th video in our diabetes series. We have covered diabetes introduction, type 2 diabetes, type 1 diabetes, and diabetes medications. If you haven't watched those yet, the links are in the description below. Today, let's dive into the cornerstone of diabetes management, insulin therapy. When to start insulin? Insulin is essential for all patients with type 1 diabetes right from the diagnosis. In type 2 diabetes, it's indicated when HbA1c exceeds 10%. Patients show signs of severe hyperglycemia or when oral medications alone no longer suffice. Types of insulin. Let's break down the types of insulin. Rapid acting for meals, short acting for more flexibility, intermediate acting like NPH, and long acting insulin like glargine or determine for basal control. Understanding their timing, onset, peak, and duration is key for safe administration. Insulin regimens. Insulin regimens can be tailored. Basal bolus for flexibility, pre-mixed for those with routine meals, and continuous subcutaneous insulin infusion, insulin pumps, for those needing intensive control. The choice depends on the patient's lifestyle and glucose control goals. Dosing insulin. How do we dose insulin? In type 1 diabetes, start with 0.4 to 0.6 units per kilogram per day, half basal and half bolus. In type 2, begin with basal insulin 10 units daily or 0.1 to 0.2 units per kilogram. Adjust dose every few days, guiding by fasting and post-meal glucose readings. Side effects and monitoring. Monitor for hypoglycemia, tremor, sweating, confusion, and address it promptly with 15 grams of glucose. Weight gain is also common, so lifestyle advice is key. And don't forget regular HbA1c checks and daily glucose logs. Interesting fact. Did you know in 1922 a 14-year-old boy named Leonard Thompson received the first ever insulin injection, saving his life from diabetic ketoacidosis, a historic moment that turned a fatal disease into a manageable one. Wow! That's it for insulin therapy, the 5th video in our diabetes series. Up next, case-based questions, a fun way to test your knowledge and reinforce all we have learned. If you missed our previous videos on diabetes introduction, type 2 diabetes, type 1 diabetes, and diabetes medications, find the links below. For more clinical contents, subscribe to 10 daily medical questions, and let's know your thoughts in the comments. We love hearing from you.